The SIIM History Committee presents an interview with Dr. Joseph N. Gitlin. This video is an excerpt from an oral history project of the SIIM History Committee. The committee works to establish resources, document oral histories from imaging informatics pioneers, and to build a reference library of items of historical import for imaging informatics.
With your perspective from both industry and academia, I'd like if you could to tell me a bit about what you see as the important role of RISC SCAR in SIIM in medical informatics.
I'm somewhat prejudiced, as you can tell, about the establishment of RISC, which was a very unusual non-organization, really unique in the sense of becoming very friendly and working closely with a core of very bright people and making strides towards what we thought was a very important goal. It was a brand new topic, the Radiology Information System, and the papers that were presented and published emphasize the specific areas of radiology that we all were very much interested in. Achievements there were in themselves the reward for the good effort. So RISC was truly a seminal organization, and the success in finding a partner like DEC-RAD and the installation of the first 5 or 6 units really made those rewards most satisfying. I think RISC doing what it did and how it did it was very appropriate. It was pretty much the right thing to do at the right time and very, very rewarding. However, upon achieving the results, all of us were quite aware we had made a major leap, but we were only beginning to get towards the top, and the goal was still a long way off, which is the rationale for DIN PACS, the networking and the picture archiving phase that we have touched upon. I am one who's mostly joking, but it got to be pretty tough at times, argued that we should maintain the university approach and not open the door to individual members, which would dilute the prestige of the organization. And as I say that with some humor, it was inevitable that we had to change, and that in fact set up a subgroup which became SCAR, had all kinds of advantages, and the ownership of JDI, for example, which Roger Bowman did a wonderful job with, getting the annual meeting on an annual basis. It was rather sporadic before, and a large cadre of qualified, talented individuals from different areas to really concentrate on the solution to DIN PACS problems. So SCAR was born, and I think coexisted as a subgroup of RISC for about 8 years, when it became clear that most of the goals of RISC and SCAR had been achieved, and now where does the organization go, and what kind of goals does it have, which led to the idea of SIIM, with informatics being a key factor. Still remembering all the achievements from the RISC and the SCAR days, which became foundation blocks in getting to the goals of SIIM and today's activities.
So, if I understand correctly, you would fall on the side of being more inclusive of other imaging specialties outside of radiology.
Oh, I was very much in favor. Certainly, this is the area of information in medicine, computer applications, is not restricted to radiology. But sure, I see the concept of medical informatics, the umbrella over all of medicine, particularly now as we move into the regional medical archive, IHE, and exchange of information on a network that allows physicians to have immediate, accurate information on patients who've been seen elsewhere. So we're on the right track. But the competition is getting there, and it's tough, and we've got to overcome the obstacles, especially of the costs of transmitting these data and the security measures that are necessary, both to ensure that we are identifying the right patients when we ask for information about them at a different institution. And we have to be very careful about protecting patient confidentiality and privacy.